I could point to points over the last 10 years and even going back 20 years where I probably felt some symptoms and just ignored them. So doctor sat me down and said, you know what, you don't have leukemia, but you do have this other type of rare bone cancer, blood cancer. And so as soon as I heard that, I sort of went blank. I don't remember too much. I remember him saying, you have polycythemia vera, and I'd like to do a phlebotomy now. I would say I'm very much a family man. So I have two young kids, 9 and 5. I'm married to my beautiful wife, Kara, for 13 years, thereabouts. And a lot of life is centered around my family and just kind of being there for them. Sports, love sports. I was a baseball player and basketball player through college, um, and just love to help people, I would say. Just since my diagnosis, really trying to get involved in the cause and just tell my story, but also hear other people's stories and just share perspectives.
And tell me about what it was that first led you to even understand. What were you feeling that led you to go to a doctor in the first place?
It's a great question. And this is really the part of the issue with PV and MPNs in general is that um, sometimes the symptoms and what you're feeling are nondescript and you can ignore them. And so that was very much the case with me, where I wasn't really feeling too much, but I went to a physical and I got a full workup, full blood workup, and they flagged a couple of numbers. And even at that point, I didn't really think I was going to follow up. I was kind of debating it, and my wife really pushed me to follow up. And that started the ball rolling of the diagnosis. But I can't really point to anything one thing in particular on what I was feeling. Now having the benefit of understanding what the disease is and what the symptoms are, I could point to points over the last 10 years and even going back 20 years where I probably felt some symptoms and just ignored them. So blurry vision and headaches, that is a big one that I experienced throughout my life. I mean, I remember being at the dinner table, eating Sunday meatballs with my family and just sort of just going blank and just thinking that I just needed 2 minutes and hopefully no one asks me a question or engages me in a conversation. Itching for sure, fatigue, and I've learned how to pinpoint what's just, kid fatigue and what's, PV fatigue. There's a big difference in that. And so I've learned that over the years.
Since we're talking about it already, I'd love to learn because I know what little kid fatigue is as well. So what is
Yeah.
that? What
Yeah.
is the difference?
Yeah. I think it's total body. And it really, it prevents you in a lot of different points to really not be able to function, which sounds, I know, crazy, right? People say I'm tired all the time, but it is muscle, it is bone fatigue, it is complete total body fatigue where your body is shutting down and saying, I can't go anymore. And if you try and push me, I'm going to just get worse. And versus kid fatigue, where you're just I feel like it's almost all in your head where your eyes are tired, whereas PV fatigue, it's everything else.
So thank you, Nick. Let's go back then to that physical and getting the results. What do you remember of what this? I imagine as your primary care physician. What was the conversation there about the results?
Well, that's the thing. I didn't have a primary care physician, and so lesson learned, right? First and foremost, I've sort of built a team, but at that particular point, it was a hematologist and oncologist that I had followed up with, and I kept trying to get the results over the phone, and they wouldn't give it to me over the phone. And so that should have been my first clue that, hey, something is wrong. It's out of the normal, and they really want to talk to you person to person. And so finally, I think it was like the third or fourth attempt where they said, no, you have to come in. We're not giving you the results over the phone. But even at that point, I still didn't think anything was wrong. The appointment I had was the same week that I found out that we were pregnant with Jake, my second child. And so, yeah, and so I was just totally consumed. The office I was going to was right next to where we would go for our gynecologist checkups and stuff like that. And so I was just completely consumed by that. And so I didn't even have a thought in my mind that something was wrong. No, so they said your hematocrits and your platelets are high. And so again, another aspect of PV and MPNs that really are nondescript is that, your hematocrits and your platelets can fluctuate, right? If you have, right, like if you're in high altitude, right, your numbers there can populate, can rise. So they gave me the option. They said you could follow up immediately or follow up in a year. And so it was really, Kara was like, what do you have to lose, right? Just follow up and see what the result is. And so I followed up, and they flagged the numbers, and they brought me in to have a discussion. And then from there, I went to Cornell and had a bone marrow biopsy to confirm it. I didn't think anything was wrong, and that was totally my mindset. Even when the doctor sat me down and said, you know what, you don't have leukemia, but you do have this other type of rare bone cancer, blood cancer. And so as soon as I heard that, I sort of went blank. I don't remember too much. I remember him saying, you have polycythemia vera, and I'd like to do a phlebotomy now. And I don't even know what a phlebotomy is, right? And so, I've really tried to, in my advocacy work, really stress the importance of that moment, right? I call it a moment of truth, where you can impact. And it's not about the doctors, and it's not their fault. It's really that particular moment can impact a patient's psyche one way or the other, right? They can go down a rabbit hole, or they can become, you can really calm someone's brain at that particular moment in time. And so I went completely the other way, where I was just blank and just confused, really is the right word to describe it. Right. I think that's immediately where my mind went, was just death, really, just to be honest, right? And just, how long do I have? And then you start to walk off the ledge a little bit once you become more educated about what you have. But that could be a year from now, right? For me, it was a whole year before I really understood it. So
I appreciate it, because it's really going in depth that will help people connect with what you're saying. So in that moment, you went blank. You heard the word leukemia. You're familiar with leukemia. I don't think many people hear polycythemia vera, right? It's just not something that comes up even anywhere. And so you left the office. You had no questions. You were sort of like, okay, I don't know what to do. You left the office. How did you break the news to Kara and others?
yeah, I remember where I parked, specifically in a parking lot. I kind of just monotonously walked to my car. I kind of spent about 15 minutes in my car, just like all these questions flooded in, right? That all these questions that I should have asked the doctor, and the top one was how did I acquire this? Was it something I ate? Was it, alcohol? All these questions flood in. How long am I going to live? And then you start doing the worst thing that you could possibly do, which is Google. It's a confusing name, polycythemia vera, right? It's just a confusing moment. That's the only word that I could really use. Like, I just didn't know how I got it. I didn't know what the long-term prognosis was. It was just a very confusing time.
So it was less of the sadness, because it was, what are we dealing with? We have no idea. It's not like you got some diagnosis. Again, like if it was leukemia, it's a little bit more understood just because there are movies about it, right? So what were those next steps for you and Kara?
Yeah, so I think, to your point before about meeting that doctor for the first time, we wanted a second opinion. And so we had gone to Cornell to get a second opinion. And that doctor was really, he was great in really breaking it down and explaining exactly what it was, and how it would sort of evolve. And so that, I don't know if that put us at ease. I mean, I will get very, descriptive here, walking into Cornell, into the blood cancer center, and seeing people that are just a lot further along than I was, or just had different types of blood cancer. It was, I had to leave the room, and I got really, really emotional. And I, I'm getting emotional now because just thinking back at that particular moment, it's just, that's where the sadness kicked in, as you were talking about, right? It went from confusion to then sadness, where that might be my outcome. Yeah, it's just it brings back all the moments that I was, all the thoughts that I was feeling about my kids and not being there for my kids. And my wife was pregnant at the time, looking at her and not being there for her. Right, we're supposed to be life partners, right? And to not to not to kind of remove myself from those life situations was really difficult for me, and I developed anxiety over it. I still get anxiety today. um it's just it was difficult. It's difficult to remember back on that, and it really hit me hard.
Hit you the hardest feeling about sort of thinking about the absence you know
Yeah,
that might
yeah,
be the result of it.
it's not supposed to be that way. And you go from that emotion where you're angry and sad, and it's not, your life's not supposed to work out this way. And then the hope is you transition into something else, but at that moment it was just, I was angry.
I again appreciate you sharing that because I think it's so natural. And people often, yeah, and people often feel alone, I think, in feeling these things. And it's like, look, you are definitely not alone. Um, how did you process and move through, by the way, all of these different, not stages, but lots of different emotions are coming up and they don't happen only once, right? So, how did you manage your way through?
I don't know. I don't think I managed very well. I internalized everything. And even, I started to recognize the symptoms more. So not only was I dealing with some mental health issues and depression and anxiety, but also I started to recognize the symptoms, and I really struggled with communicating. um, how am I supposed to tell Kara I'm tired, I'm fatigued, right? Like, what is that? Or I'm itching, or I have bone pain, right? Or I have blurry vision. Like, those are, you know, just I felt like I would be looked at like I'm a complainer. Um, yeah. Right. And so I just internalized everything, and it just ate at me, and it ate at me. And it really, it just affected my personality even, right? It changed me. And like I said before, it's not supposed to be that way. But life doesn't always work out perfectly, right? It's there's so many quotes out there that says, it's how you get knocked down, but it's how you get back up. But it's tough to realize that in that moment, right? It's Some people can do that, some people, takes a while. For me, it took a while for me to realize that.
But I think what's important is to allow ourselves the space to be able to feel the way we feel without guilting ourselves, right? That's the worst, I think, is to feel it and then be like, I can't believe I'm doing this to myself. Um, so moving back to now, I'm curious how that doctor at Cornell, by the way, was it just that Cornell had a reputation, big institute, academic institution? How did you know to go there? And then if you could also describe how the doctor laid out what PV was, for you at the time.
Yeah, it was, the local doctor recommended someone at Cornell, and since then I've changed doctors, which is hopefully another topic we'll talk to, about really personalized care, and really being your own advocate. Um, and so I figured, that would be a good first step, to go there, and it was a very well-known institution. So I felt comfortable going there and getting, or validating, the diagnosis. And really, the great thing about this particular doctor was, he got up on a whiteboard, right? And he really sketched out, like, where it came from, right? And the bone marrow and the particular body part and the long bones, and sort of the evolution of the stem cell mutation, right? And we learned so much, right? Like, we have a histamine stem cell that derives from that also gets mutated, which is why sometimes the itching happens. And so he really broke it down, and I took a picture of that, and I have it to this day. And I occasionally refer to it, just to kind of, again, understand everything that's going on. But he really took the time. We were there for, 3 or 4 hours of him just explaining it. Yeah, and I also had the bone marrow biopsy, but a good portion of that was him explaining it and answering our questions. And we didn't feel rushed at all, which was great.
And we'll talk more too about the advocacy work in general and your greater purpose here that you've really dove into. But so, okay, so then you got this second opinion at Cornell. What was he explains everything in terms of how this would, more than the disease itself, though, how did he describe how this would impact your life? A lot of times people think, well, what's the treatment and how am I supposed to deal with this, right? That's the general conversation. So what did that look like for you?
Yeah, he described the fact that it would be a long-term uh, disease, and for me, that didn't put me at ease. That meant I would have to deal with this for the rest of my life, right? Potentially. He talked about the fact that this is a slower progressing disease, but again, and then that was in the beginning. So for me, I don't hear that. I hear, well, if I have it at a young age, right, that gives me more time to progress earlier, right, than someone who was diagnosed a little bit later in life. And so he was explaining some things about symptoms as well, that you may feel this, you may feel that. It's important to kind of slow down. But it's almost like I interpreted it differently, right? Um, he did talk a lot about the symptoms and the randomness of the symptoms, right? They might pop up when your numbers are high, but they may pop up when they're not. You may get a whole bunch of symptoms. You may get, a few symptoms. They may be severe, they may not be. And so it was almost like from that point, I was hanging by every day, right? What's going to happen today, right? What's going to happen tomorrow, right? Am I going to progress tomorrow? My symptoms going to be bad? Are they going to be low? And it was just consuming.
Since we're talking about that, how long, I mean, were you able to figure out how to deal with all these consuming thoughts at what point, right? How were you able to move past that part of, this? If you were, I mean, it might have taken a while.
It did. It took, I would say, maybe a year plus, and I relate it back to you know being on the Voices of MPN website, signing up for the patient advocacy group, the champions, and then getting a call from someone I didn't know, right? And telling my story, right? They were asking me questions, but the fact that I was telling someone I didn't know my story, it was such a freeing experience to me that it just made it okay to get it out and tell people really how I was feeling. And so it was that particular moment, a year in, where I shared my story for the first time to someone. And that was the jumping up point where I loved how that felt, right? It was just a freeing feeling. And I wanted to continue to do that. And it was just a great feeling. It was just a great feeling.
Nick, part of this too made me think about how PV and other very rare cancers, so little is known. Also, when you don't have to go through the stereotypical, what's shown in the movies kinds of cancer treatment, there can be a huge gap of understanding, right? Oh, you look fine. You look great. You seems like you are totally fine, right? So can you talk about that?
I think a lot of people, I've talked to a lot of patients that really look great, right? But they get beat down by the symptoms, right? Every single day, very severe. They get beat down, and that has an effect on your mental state and your ability to sort of deal with it. But it doesn't necessarily come through, right, in the physical appearance. And a lot of times we get dismissed. And so that, for me, that's why I make it a point to talk about it often, but also talk about my doctor, right? That's how we start the visit, is how I'm feeling. And I give him everything, right? I give him everything. I cut my finger. Because I don't, first of all, I don't know what is relevant and what is not. I've learned that, but I give him everything, and we kind of talk about how I'm feeling. But we can get dismissed. I've had an experience prior to this current doctor where I was dismissed, right? And I was kind of viewed as a complainer. And I have an experience now where that's the complete opposite, right? Where we actually have a dialogue about that.
Let's just talk about what bad looks like a little bit. Because I think people might feel alone here too, but it happens. What happened, with the doctor where you felt dismissed?
Yeah, I would talk about, fatigue and itching, and there was one time where he says, well, you have kids. Right. And you work. And I'm like, yeah, but doctor, this is different. This feels different. Um, and it was just kind of just writing it down and just kind of moving on to the numbers, right? And PV is so much more than the numbers, right? So much more than the numbers. If you're going in there having a conversation with your doctor about just numbers, then that's the wrong conversation. I mentioned before about the hanging on a thread, like you never know when it's going to happen. And so I would almost wake up that morning, saying, "Well, what's going to happen today?" And I would almost feel something every single day, either a combination of things, or one like you're talking about would be very severe and the others would be very low. And it's really it's difficult to deal with. Again, I internalized it. I dealt with it from a mental standpoint, and it would distract me. It would really distract me.
You describe this as almost like waiting for the other shoe to drop, feeling of and unclear of when that's going to happen. What exactly, for people who aren't as familiar with what that means, what were you nervous about happening?
Progression into myelofibrosis, for sure. Because I actually researched and I pulled numbers from the last few physicals I had. So it was basically 10 and 15 years prior to diagnosis, and my numbers were high then, right? And so then you start to think about, well, I've had this a lot longer than when I was actually diagnosed. And so I'm further along on the progression trail. And one day I'm gonna wake up and I'm gonna have myelofibrosis. And that's really what I was worried about. Um, and I'm still worried about it, if I'm being honest. Um, I think about that, weekly. I used to think about it daily, but now my mind is. I've trained myself to kind of think about the good things. I focus on the present. I focus on my kids, my wife, the good things in life. Right? There's so many good things about life that we should just be in the moment and not get too far ahead of ourselves. I think the exciting thing is, and you mentioned this, that there's been a lot of advancement in treatment options for PV. And so when I was diagnosed, it was a wait and see approach. Baby aspirin and phlebotomies every so often. And phlebotomies can be taxing. My iron levels really dropped. And I remember when I got to the doctor that I have now, and we talked about drugs that are on the horizon. So we talk about being a patient advocate or being an advocate for yourself in treatment. I would suggest doing the research on what's out there currently, but also what's to come, and really having a conversation with your doctor about that. And so we got to talking about a potential drug that is now FDA approved, where that could be a more proactive approach to your treatment options. And that's the drug that I'm on now, Besremi, that also is supposed to slow progression, which was, for me, something that I was extremely worried about, and a lot of PV patients are too. So, there are a lot more options now, frontline options now, for PV than there ever were before.
And so, can you compare also how often you were having to go in for phlebotomy or take baby aspirin versus now being on Besremi, what the differences are and what that looks like for other people who are curious?
Yeah, so I was going every week to start, and then it graduated to 2 weeks, and then I kind of settled in on like every 3 weeks. But also, going to the randomness aspect of this, sometimes I'd go months without a phlebotomy, and then all of a sudden I'd have to go every 2 weeks again. And so that's the frustrating part, because you can take that and overreact to it, right? I equate PV and MPNs to a baseball season, right? And even a basketball season, right? Basketball season is 82 games. It's long. You can't overreact to any one game or one day, one loss or one win, right? You have to look at it as a whole and really be in it for the long term.
I'm so happy to hear that. Because these are the little nuances in the quality of life that build up and matter, right? But can be hard to see. So, any last thing you want to say in terms of the shift, looking at, and I do want to talk about actually what prompted you to go to see another specialist, to see somebody else after that Cornell doctor. What was it that drove that conversation, and how did you find that person? And then what's the difference been?
Yeah, I think it was that dismissive part that we talked about, right? Not feeling that the person was spending time really getting to know me, looking beyond the numbers. And I think the one thing that's related to this and what I would leave people with is that there is a support system out there, right? Beyond like family and friends, right? The MPN community is small, but it's growing, and there are people that are willing to help. And so through that community and through the people I've met, I got to know other doctors, and I did my research on the other doctors and settled into one doctor in particular that really just spent the time getting to know me beyond the numbers.
What is that message that you'd like to leave with, for PV patients, MPN patients, and then others across the board, in terms of how you've become this sort of empowered, this representation of empowered, and what you've learned the most and what want to pass on?
Yeah, I would say don't go at it alone. I know there are people out there, a lot of people out there that struggle with this mentally. Just make sure that you have a support system. There is a support system out there, and communicate. Right? If you don't communicate, it's going to eat away at you. And there are different ways to communicate. Right? There's written, there's email, there's social, there's person to person. There are a lot of great advocacy groups out there. That I belong to and I've joined, and just to share perspectives, right? I think that's one of the great things about a support group, is that you hear different perspectives, and people deal with things differently, and you gain just knowledge. So there's support out there. Please, there is support.
Well, thank you so much, Nick, for joining us for this conversation. I know it'll be so impactful for everyone who's watching.
Thank you for having me. I loved it.